Welcome to the Dartmouth College Environmental Health and Safety video on cleaning, disinfecting, and best practices for employees in office areas. The following guidance is for employees working in office areas to help identify approved COVID-19 disinfection methods and additional best practices for employee safety. Additionally, all staff are expected to fully comply with the policies, protocols, and guidelines, including health screening requirements, outlined in the published workplace policies found on the Dartmouth College COVID-19 webpage. COVID-19 is thought to spread mainly through close contact, within about 6 feet, from person to person. People can transmit the SARS-CoV-2 virus, which causes COVID-19, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These drops can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some people without symptoms may be able to spread the virus too. We are still learning a lot about COVID-19, but it may be possible for it to spread in other ways, such as through touching contaminated surfaces or objects, though this is not thought to be the main way the virus spreads. It is important to consistently follow good hygiene and social distancing practices and to clean and disinfect frequently touched surfaces regularly. Hand washing is critical. Wash hands thoroughly for 20 seconds with soap and hot water. Rub hands together. Lather the backs of hands, between fingers, and underneath fingernails. Rinse hands well. Dry with paper towels, then turn off the faucet with a paper towel and discard the towels in the trash. If you cannot access a sink right away, hand sanitizer containing at least 60% alcohol can also be used. Other good hygiene tips include avoid touching your eyes, mouth, and other parts of your face. If you have to cough or sneeze, do so into a tissue, followed by hand washing, or into the crook of your elbow. If you work in an open office environment, be sure to maintain at least 6 feet distance from your coworkers. If possible, have at least one workspace separating you from another coworker. Rearrange desks so coworkers are not facing each other. You should wear a face mask or face covering at all times while in a shared workspace or room. During your time on site, you are encouraged to communicate with your colleagues and supervisors as needed by email, instant message, telephone, or other available technology rather than face-to-face. Pay attention to newly posted signage in your work areas when returning to work. Departments with open work environments and meeting rooms should institute measures to physically separate and increase distance between employees, other coworkers, and customers. Look to FONM for guidance on required signage in your area. Signs, posters, and decals are available through Dartmouth College printing and mailing services. Face coverings are required at all times when using or accessing shared or communal spaces at any Dartmouth worksite, and also when a minimum of 6 feet of physical distancing is difficult to maintain, including walking in narrow hallways where others travel, and in break rooms, conference rooms, and other meeting locations. Remember, face coverings do not replace social distancing. They are meant to prevent you from spreading the virus to others in the event you are asymptomatic. Social distancing will keep you safe. Cloth face covering should fit snugly but comfortably against the side of the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, and be able to be laundered and machine dried without damage or change to shape. If the face covering becomes soiled or soaked, it should be replaced with a clean face covering. Coverings should be laundered frequently. Individuals should be careful not to touch their eyes, nose, and mouth when removing their face covering and to wash hands immediately after removing. If a face covering becomes damaged, it should be discarded. Please refer to the Dartmouth face covering policy for more information. It's also important to disinfect high-touch surfaces regularly. Staff should disinfect items such as personal desks or workstations, phones, office room light switches, copy machines and printers, shared computer equipment, coffee machines, refrigerator handles, microwaves, and tables in between use following CDC recommendations. Custodial services will disinfect surfaces in hallways and at building entries and exits. Use a disinfectant that is certified by the EPA to be effective against the COVID-19 coronavirus. To verify the disinfectant is on the EPA registry list, Search for the product name or EPA ID number located on product packaging. The product label may also list coronavirus among the organisms for which it is approved. Clorox and Lysol wipes are commonly used disinfectants. The following additional tips will help ensure work surfaces are disinfected appropriately. Reduce clutter so that desk areas and other work areas can be properly disinfected. When using a disinfectant, follow the manufacturer's instructions for use and wear appropriate personal protective equipment. Generally, a pair of gloves is recommended. Wash visibly soiled areas with soap and water prior to disinfecting. Read the labels on all products and follow instructions for proper use, including required contact time, which is the amount of time a disinfectant needs to remain on a surface to effectively kill microorganisms. Use care with delicate equipment and electronics, and don't forget to remove your gloves and wash your hands when finished. An additional workplace scenario to keep in mind is the use of elevators. No more than one person should enter an elevator at a time, so please use the stairs whenever possible. If you are using the elevator, wear your face covering and try not to touch the elevator buttons with your exposed hand or fingers. Wash your hands or use hand sanitizer with at least 60% alcohol upon departing the elevator. Another consideration is mealtime. You should wash your hands before and after eating. If dining at work, you should wear your face covering until you are ready to eat and then replace it afterward. Staff are encouraged to take food back to their office or to eat outside. If dining in a common area, individuals should be 6 feet apart from one another and should not sit facing each other. Remember to wipe down common items like the refrigerator handle, microwave, and tables when you are done eating. That wraps up our cleaning, disinfecting, and best practices guidelines for working in office areas. If you have any questions, please reach out to Dartmouth EHS and we would be happy to help.